you ever found yourself stuck in an unhealthy cycle of behaviors and emotions that too often spin out of control and lead to anger, resentment, frustration, and sadness? On today's episode, Jake Baczuk joins us and breaks down the pain and peace cycles and offers helpful tips that can break the cycle starting today. It starts with understanding both yourself and your partner. Join us for an incredible and insightful discussion. Jake Baczuk is a therapist and clinical manager for Evolve MD, an integrated behavioral health company that utilizes the collaborative care model in primary care settings. Together, they're creating access to mental and behavioral health to a population that would not otherwise receive help. He enjoys writing and playing music, playing softball, watching baseball, and spending time with his wife and 3 kids. He enjoys doing couples therapy and plans to start a small private practice in the near future. We hope you enjoy the show. Hey friends, welcome to another episode of the Stronger Marriage Connection podcast. I'm Dr. Dave here at Utah State University alongside Dr. Liz Hale, our licensed therapist, and we are aiming to bring you the very best we have in research and resources along with tips and tools to help you create the marriage of your dreams. All right. Have you ever felt like you and your partner have been caught in unhappy or painful patterns of behavior? Well, underneath our behaviors are emotions and these deep unmet needs. And coming to a greater awareness of these can be empowering and help us break out of the negative cycle. So here to discuss this pain cycle and this peace cycle is therapist Jake Baczuk. Welcome to the show, Jake.
Hey, thank you, Dave. And thanks, Liz, for having me. I really appreciate it.
We appreciate it too, Jake. Thank you.
Yeah, looking forward to this, Jake. Hey, so you are we got to address this real quick because you're an Aggie, right? You got your undergrad and a graduate of our MFT program at Utah State. And Liz is an Aggie. I got my master's at Utah State. So this is a great Aggie show, Jake.
That's right. Go Aggies. That's right.
Yeah. Hey, tell us briefly, we talked a little bit about this before we hit the record button, a little bit about briefly your background, kind of your passions, why you got into this area and wanted to be a couples therapist.
Sure. Yeah. So I'll keep it brief because it's a really long story, but I was actually doing mechanical engineering at Utah State in just the bachelor's and got 2 years into that and was doing awesome. Like I loved it and it was great. My dad's an engineer. My older brother's an engineer. And then I just kind of felt like I got to do something different. I got to do something that is involved with people directly, you know? And so interestingly enough, Ryan Seedall, who's the MFT program director today, back then he went to church and gave us a message at church and told us his story about how he was in engineering at first and then switched to marriage and family therapy. And so for me, I took that as a sign of like, oh, okay, well, I was doing engineering. Now I need to go into marriage and family therapy. And that's working with people directly, right? And so, and I specifically chose marriage and family therapy, not just because Ryan said it, but because I really feel that marriages and families are a key component to society, right? And if we can have healthy marriages and healthy families, then we can, move society in a healthy direction, right? And so I wanted to save the world and save marriages and families. So that's why I chose that.
Love it. Absolutely love it. Yeah, we're all in this, right? Liz as well in this to help relationships thrive and flourish. Love it. Thanks, Jake.
So you're a marriage engineer, we could say.
Yeah, that's right. My wife says I'm a half an engineer.
That is really some change. That's just really fascinating. Well, lucky for your couples, you switched gears there. I know, getting a master's and a doctorate, my fellows cohort, none of them were wanting to do marriage therapy. It's a bit intimidating, right? To be in a room and now you have 2 people. It's rather complex, but I really loved it. You really love it as well. What drew you to working with couples as opposed to working with individuals?
Yeah, I like that question, because there is a difference, right? There's
Big difference.
right. You have the individual that comes in, it's complex, and sometimes as therapists, like we don't like to say it, but sometimes we're like, oh, I don't know what to do, right? How do I help this person? And so when you have two people come in that are complex, right, and now you see both of them, you're like, oh boy, right? But for me, when I got that experience right in the program, doing therapy as a student with couples and things, and getting all the feedback from supervisors and peers and everything, it was really cool, because the challenge is it's doubled, right? And so then the reward of it is also doubled, right? So when you get to see one person break through and understand what's going on in their marriage, and now starts to react and communicate differently, and the other is now starting to pick up on this, right? And then they both look at each other, and you see that there's healing and there's progress, right? That to me is like, it's so much better than just seeing the one individual, right? That's awesome too, but it's like, cool, there's healing in a marriage here that is just so fulfilling to see. So
Doesn't get more satisfying than that, does it? Especially when you
no,
look at a couple and they're in charge of a family and they're in a neighborhood, a community, and extended family goes on and on. It's a ripple effect, that growth
absolutely.
and healing. I love it.
Mm-hmm. Jake, you chose restoration therapy of the model, kind of the theory of change for that assignment, right? That master students have in MFT. What led you to choose that for your model? Tell us a little bit about restoration therapy. You can walk us through maybe a little bit about what that is, that approach for our listeners. And then how do you help couples who struggle to really recognize those patterns of behavior and communication?
Yeah. So restoration theory, I'm not going to pretend to be an expert in it, right? But it really struck a chord with me, because it's a combination of a couple of the theories, right? Of contextual and attachment based theories, and so, but the contextual piece really hit home with me because um, the idea that we're not just born with something, right? It's a nature nurture kind of a thing, and so the way that we're raised, the parents and siblings and friends and the greater macro system and all that stuff, it all plays a part into our lived experience, and so restoration therapy hones in on two specific things: feeling loved and feeling of trustworthiness, right? We as human beings deserve those two things. We deserve to be loved and to have trustworthiness in our life. So when any of those are breached, either of those are breached, um, we our brains try to cope with it somehow, right? Whether it's a personality or an attitude or behavior, right? We have these emotional experiences that we can talk about a little bit more, that drive the way we react and behave in certain situations, and in particular within a marriage or a couple's relationship, right? How we can react, and um, so the love and trustworthiness are huge, right? And that really just kind of struck me, because I have these values of wanting to show love and be loved, and this and to trust others and to feel safe and all of that. We need that. So so your second part of your question was, how do we apply that to the couples?
Yeah, what does
Is
that
that
look
right?
like? Mm-hmm.
Yeah. So I don't know if you were going to ask for examples or anything,
Please, yeah, please do.
but yeah, so how I apply it to kind of a couple session, if I can kind of lay out a picture for you guys. So let's say you have a husband and wife, right? For the example's sake, and they both are coming in with their individual complex, complexities, from things that they've gathered from childhood and onward, right? Whether there was trauma or things like that, growing up and moving on into past relationships and everything. And so you have these two individuals, and what I like to do is create awareness around the primary emotions of this love and feeling safety, right? And so I'll pick one. I'll pick either a husband or wife or whoever feels comfortable going first, and I'll ask permission from the other to say, hey, would you mind if we take a second with this, we'll say the wife, right? Do you mind if we take a second with her for a minute to explore some things? And they usually are okay with that. And so then we explore some things, right? And then I typically ask them questions about what kinds of communication styles that they use, right? And things maybe that they don't typically love in what they say or do, right? And we kind of explore those things. And I dive into what we call the pain cycle, right? So I don't know, did you guys want to go into that now, or do you have other questions you want to ask before I dive into that?
Well, I'm just so curious. So with restorative therapy, we are restoring the love and the trust. Is that fair to say? What's the simple version of that? What are we trying to restore for couples?
Yeah.
Love and trust.
Love and trust. Yep. And sometimes we can do that with parents, right? And including parents into the process and helping, kind of get some more understanding of where things went, this way or that way. But sometimes we can't. And so the model does a really good job at doing it on an individual base, right? And doing that with the couple present, right? So that the other is witnessing and really understanding where their spouse is coming from, right? And so, yes, Liz, we're restoring that love and that trustworthiness, and then we can do that in the marriage.
Thank you, Jake. And then you mentioned the pain cycle. So we've got the pain cycle versus the peace cycle. Can you walk us through both of those and and kindly even give an example or two as you go? How do you use that in the couples therapy setting? Is there a couple that comes to mind you could kind of talk to us about them without sharing, of course, their names, but
Yeah, absolutely. So, a couple definitely comes to mind. So we can kind of go back to this image that I'm kind of setting up as a session, right? And we'll use this couple that I'm thinking of as the example, husband and wife. A little bit of context here. Husband cheated on her. They don't have any kids. He cheated on her, and he actually went to KSL and found men and cheated on her with men, right? And so that added a huge layer of complexity to this betrayal trauma that she had already experienced, right? And so so you can imagine kind of how she might be feeling in this situation where love was breached and trustworthiness is breached, right, within the marriage context. He was 100% into fixing the marriage and making it work. And she was trying to figure that out for herself, whether she wants to stay and work it out, right? Right. And so we eventually got to the point where
devastating scenario, right? There are a few things I think that are worse that couples deal with in marriage. It's difficult. And I'm always so inspired when I get through the other side. Please go ahead.
Right. Absolutely. So yeah, she was trying to figure out where she was, where she stood in all of that. And so we worked through some of these things. We got to the point where she was in on it and she wanted to figure out how to make things work, which was really cool. And that's why, I just love this couple because they're both so humble and willing to work on those things. Right. So how it ties into the pain cycle, right? We'll jump into the pain cycle real quick. So for her, I'm going to pretend like I have a whiteboard. I love using whiteboards. So I would draw a box up here, right, in this top part of the whiteboard, and then a box over here. And so you have kind of this diagonal of this box up here and here. And I would start here in the behaviors. And so I would identify with, we'll say the wife, right? I'd identify with her. Okay, so what's a time where you guys had a fight or whatever? Maybe it's not a huge, massive fight, but we had an argument or disagreement, and how did you respond? How did you react, right? And so I'll put in here maybe some of the things that she did
Might have been anger. Maybe she threw a shoe. Or am I saying too much?
No, that's fantastic.
About my own life.
Right. Let's do a little bit of therapy here, right?
No, so those things that she did that she's not proud of or proud of. Okay.
Right. Yes. So tends to be controlling, right? And nags or whatever it is, right? We put that here in the behaviors. And then I say, okay, let's take a step back and let's see why. Why are we reacting this way, right? What am I feeling that is causing me to do this stuff, right? Because we can all agree that we don't like this, right? We want to change these behaviors. How do we do that, right? So then we go back up to this box up here where we identify the primary emotions that are driving these behaviors, right? That came from the breach of love and trustworthiness, right? And so she feels betrayed, right? She feels betrayed. She feels unloved. And she feels alone, right? She doesn't know what to do. And she even, seeing the greater context, nobody else's husbands have cheated on them for men, right? I'm alone in a lot of ways. And so she's feeling these primary emotions that are driving her behaviors, right? And so we kind of identify how that's a cycle in and of itself for her, right? And all this time, he's sitting there watching this, right? And witnessing us uncover all of this stuff for her, right? So not only is she getting this insight on herself and saying, oh yeah, oh wow, yep, that makes a lot of sense, right? He's also getting that experience too. And is saying, oh, okay, so when she's doing that she's feeling okay. So they're piecing this together, right? So then I say, okay, can I go to the husband? Thank you for this, right? Can I move to the husband now? Is it okay if I spend some time there? And so I do the same thing, right? And I draw a square down here for his primary emotions, and I draw a square over here for his behaviors. We do the same process, identify the behaviors, then we go back and figure out what's driving those. And then the coolest part with the pain side that I love the most, right, is connecting all four of them, right, with these arrows. So there's arrows that go all the way around these and say, okay, so when she reacts this way, you likely feel this way. And when you feel that way, you react this way. And that likely influences how she feels here. And that's why she kind of jumps in and does this, right? And then their minds are blown, right? They're like, oh my gosh, you're totally. So I just take a step back and say, how does this fit with you guys? And 98% of the time they'll be like, oh my gosh, how did you do that? Right? It's like this magical experience where that now they really understand what's going on in their marriage, right? And when that understanding is there and happens, it creates an opportunity for them to do something different, to change, right? So then we go through the process and we do a lot of different interventions to work on these primary emotions so that we can change it into a peace cycle, right?
And I got kind of a simple mind here, Jake. So the first one box is behavior, right? And then the other, go ahead. One box is a behavior and the other box is for?
Primary emotions. Yeah.
Emotions, yeah.
Yep. So the primary emotions that are beneath the behaviors, that are driving the behaviors, kind of like a CBT kind of a thing, right? Mm-hmm. You've got the thoughts, emotions, behaviors, and this we particularly focus on the deeper emotions and the behaviors.
So,
right?
So tell us about that couple. How are they today? And so I'm sorry, did I understand he cheated on her? He stepped outside the marriage with women and men?
Just men.
Yep. Oh, just men.
Mm-hmm.
So
to give you a little bit more,
that didn't mean he was gay.
So that's the thing, right? That's the complexity of the whole thing is now she's asking questions of, okay, does he love me? And is he even attracted to me? Is he attracted to women, right? So to give you a little bit more information on this couple, he was not gay. In fact, he was sexually abused by his older brother, I think, for an extended amount of time when he was a child. And so there was a lot of that playing into why he lashed out in that way, right? Lashed out or acted out. And so there was all of that, right? And so, but the fact that it was with men, she couldn't trust, right? She couldn't trust. And so we really had to work on this trust piece and really breaking some of those things down. So, they got to a point where they wanted to stay married, and they were having discussions of wanting to have children, but she couldn't move forward in that area. She still needed some work and to work on some things individually for herself. They so let's see. Fast forward 3 years. My wife and I and our kids, we went to an event up there in Logan and Wellsville area. Community event, lots of people there, and I was just on one of the attractions there on a train or something, and out of the corner of my eye, I caught a couple that was pushing a stroller, and I saw them, and I was like, "That's them, that's them."
Oh my goodness!
They're pushing a stroller with a child in it, right? And so, that just showed me that they continued to work hard. And they moved forward and with their family and their marriage and everything. And it was really, really cool to see. It was like one of those things where you can't, yell out and say, hey, because of HIPAA and all the stuff, confidentiality. But it just was warming, in my heart to see them, that they were successful and everything. So,
oh, wow. Nothing
really cool.
better. Good for you, Jake. That is so exciting.
Yeah.
I know, it's kind of like you see a couple out in the public. It's like, do they want me to say hi? I should
right.
ignore them, right?
Right. You kind of give them a wink so nobody sees.
That's very cool. Good for you.
We'll be right back after this brief message. And we're back. Well, let's dive right in.
Yeah, that is great, Jake. So in my mind, I'm trying to, not being a therapist, but trying to picture all this. It feels like these, external behaviors, and instead of, a spouse or partner reacting to the behavior, they need to respond to the emotions and to the underlying needs that they have, and the pain, the hurt that's happening, instead of, reacting to this, to the arguing, to the words and all this stuff that is said. That sounds like that pain cycle. So the peace cycle, then walk us through that. Maybe I missed some of that with the different cycle, the peace cycle. What does that entail again?
Yeah, no, great question. I didn't touch on the peace cycle yet, so I'm glad you brought that up. But you're totally right, Dave. It's a matter of them identifying those things and responding rather than reacting, right? So when we create that awareness with the pain cycle, we now have this opportunity to respond because we understand ourselves better. We understand the other person better, right? And so we respond. So when we respond, we set up peace cycle, which is just the same exact thing, right? These 4 boxes, and instead of the breach of love and trustworthiness that we feel up here in these primary emotions, we start to restore the love and the trustworthiness, right? The restoration piece. And so and I wrote some notes on here and I'll look down here to kind of reference, but for this particular couple, right? She started, after working hard and recognizing these things and different interventions that we used going through the process, she started to feel more loved and more wanted up here by him, right? And when she felt that, she felt more than enough. She felt like she belonged in the relationship. And so the way she reacted was not so much controlling. It was more of this healthy give and take, right? Where I give and I take, right? As opposed to just taking and just give me, right? And so she had this, right? She looked inward to herself. She was more, she was taking more initiative to react in different ways and to give him love, right? It wasn't all about her anymore. It was, well, I understand now that he needs love. Like things happened to him in the past that are driving his behaviors. And so now I need to show him. So she did that, right, in her behaviors. So when that happened, right, we go to him, and it influenced his primary emotions to where he felt more confident and more empowered, right? He felt trusted in the relationship as opposed to she can't trust anything, right? So when he felt those things, instead of in the past in his pain cycle, he would withdraw, right, to avoid conversation. He would withdraw to sulk, right? And instead of doing that, he was more engaged, right? And he was more nurturing and showing love to her, right? And involved in a lot of things, and involved in things that she cared about, right? Things that she was passionate about for her, her hobbies and things like that, right? And so when he came to the relationship that way, it increased her emotions of feeling wanted and loved, and that she belongs, right? And so then it just started to form this cycle where it created a lot of peace in their marriage and in their relationship, to where they could move to have children, right? And move on with their relationship. Now, that's not to say that the pain cycle doesn't come back up. It's not to say that everything is perfect and lovely and flower, because we're human beings, right? Marriage is full of conflict, and that's okay. It's actually a healthy thing if we know how to do it, right? Where we respond instead of react. And so, but for them, it really showed that it didn't have to stay painful all the time, right? We can actually move forward and create some peace. So,
Oh man, this is great, Jake. So again, in my mind, I may rehearse some of this. It feels like that the understanding, when she has understanding and compassion, not excusing like what he did, it was still wrong. But when you can understand maybe some of the reasons and some of the pain of the things of maybe why, and then having compassion and responding differently, then it gives him a different person to respond to. It's not the nag and the person that's making him feel shame, but then it's this upward cycle rather than this painful cycle, that they're getting in. So this is starting to make sense in my own mind of how easily it is for couples to slip into these patterns and not even realize it. But they create these habits that I will react this way, which then this person responds, and off we go to the races, not realizing how to do that. So you're giving couples really tools. I mean, it's information, it's knowledge. It's trying to pull them out of the cycle and say, look, this is what you're doing. And when they see that, do you give them, I don't know, homework assignments or things to say, okay, this cycle is really, you may slip back in it because it's easy to get back into this cycle, but I want you to pause, right, and step out of this. Is that some of the, I guess, the concrete things as you talk and as you tackle this together with couples and give them things to work on?
Yeah, there's lots of stuff, lots of different directions you can go as homework, but absolutely giving them homework. The first piece of homework that I give them is to just notice it, right? I don't want them to do anything to change it. I don't want them to do I don't want them to feel the burden of having to fix all of it right now. I just want them to recognize when this is happening, right? And maybe we just let it play through and just let it happen, right? But as long as we're recognizing that it's going on and we're seeing this cycle, like, oh, I felt this way, right? Or, oh, he's behaving this way, so he must be feeling this way, right? As long as they're creating awareness to that, man, we can do so much with that, right? You can even use other models of therapy like CBT or DBT or acceptance and commitment therapy, right? All this stuff we can start to pull in and start to break these things down as long as they're aware that it's happening. One thing that, as you were, recapping all that or summarizing that, Dave, which you did a really good job of, it made me think, one caveat that I throw out there, or one thing that I want to make sure that all couples understand is you're not trying to fix the other person. You can't change their primary emotions. And I don't know if you noticed before, but I said that their behaviors influence the primary emotions, right? They're not making them feel those things. Those are things that have happened from the greater context, right? these primary emotions we've experienced way before our relationship, right? And so it's nobody's responsibility to fix the primary emotions. We just need to show up as a different person, right? We need to go inward, be aware of our stuff, and start to work on those things so we can respond and be a different person for the other person to respond to, right? I loved how you said that, Dave. So yeah, I want to make that clear that nobody's fixing the other person, right? We're kind of doing individual work while the other person's witnessing it. And we're kind of starting to see that healing. So
yeah. That's powerful. This has been helpful. Thanks, Jake.
you see why it struck a nerve with me, right? It's really cool stuff.
You don't have to convince me, of course.
Right.
How do you balance addressing the individual issues versus the dynamics that are in couples therapy? Are there times, Jake, when you recommend someone go to do some individual work?
Oh, yeah, absolutely. In fact, with this couple, this example that I gave, both of them, we encouraged them to both do individual therapy outside of the couples therapy, right? So they were doing their own work. They were getting trauma therapy for their stuff, right? While I was their couples therapist, I was treating the relationship, right? But it's an interesting and kind of a gray kind of situation where you hear me talking about they're working on their individual stuff while the other person's present, and there's kind of a piece of that in this couples therapy that I like to do is let's pause for you for a second and focus on them for a second. And then we start to do some of this individual work in the couples therapy setting, the whole, right? And then the other it's so amazing to see the witness that is seeing the individual work done, just gathering so much more understanding of their partner. And it's so healing and so it creates this great opportunity for them to start to respond, right? To start to do things differently and communicate differently. So yeah, there's a lot of individual work with the stuff that I'm doing, but it's definitely there with the other person involved, right? And that's a key part of all of it, right? But yeah, they have individual therapists. I recommend that to them all the time. What I won't do is do the individual therapy, with all of them, have the 3 therapy sessions, right? I let them do their individual therapy and I take on the couples stuff.
I see. Yeah. So it's really effective, especially when you have an individual therapist who's like-minded, right? Who's very pro-marriage. So I suppose there's some wisdom in choosing wisely.
Yeah. Yep. And there's recommendations I give and things like that. So.
Jake, let me ask you this. There's some listeners right now who are listening to this. Let's say that there's a wife listening to this and she's like, oh my goodness, for the first time, she's kind of feeling this sense of, okay, wow, I didn't realize that, we've been in this pain cycle for so long, but it's just her listening to this, right? Do you have even a tip or two? And they're saying, I don't know if we want to go to therapy. Any advice for, like one person listening to this, tips, concrete things that one person can start doing just from listening to this? Their maybe spouse or partner's like, no, I'm not listening to the podcast, or you know what I'm saying? What tips do you have for one person?
Yes, absolutely. And you bring up a good point. There's always those situations as a couples therapist where one is in it and one's not even going to come, right? So it's a great question. For the one person that's sitting here and listening to this and thinking, oh, this resonates with me, right? And what can I do? I would encourage them to look inward first, right? I would encourage them to just notice the 2 squares, right? Don't put so much focus on the other person right now. Just focus on, okay, I reacted in a way that I don't like, right? And it moved the conversation or the conflict in a direction that was not great for either of us. And I reacted, right? And looking inward and to figure out, okay, why did I react that way? What were these primary emotions that I was experiencing that pushed me to do that? And what can I do with that next time? Right. That's what I would say is kind of look inward. And then once you get a kind of a good sense of what's happening for you and you're starting to recognize this in these moments, then I would start to say, okay, now try and apply that theoretically. If the other person is not willing to even talk about this stuff, right? Theoretically apply it to, why might my partner be reacting this way? What might my partner be feeling in their primary emotions that would push them to do this? Well, I know that, let's say, okay, my husband was beat all his childhood by his dad or whatever it is, right? And that kind of breached this trustworthiness for him. He knew he was loved by his dad, but couldn't trust and never felt safe, right? That makes a lot of sense why he's lashing out or doing this or withdrawing or whatever it is, right? And now you can start to theorize why the other person is reacting the way they are and create more understanding. So when you have that understanding, you have that opportunity to respond differently, right? So, but I'd say start with yourself first, right? We don't want to start putting theories in and doing all that with anybody else until we've got a good understanding of where we are and what we're doing and how we can kind of change ourselves. So
love it. Yeah. Thank you. Jake, we have therapists obviously that listen to this and tune in once in a while. Do you have any advice or tips for therapists or counselors that have couples on their schedule and they feel a little intimidated by some of this?
Yeah. Oh yeah, absolutely. First, I want to say it's scary. It's hard and it's scary. And it still scares me sometimes, right? When couples come in here, I'm like, whoa, wasn't expecting that, right? And that's okay. It's okay because we're human beings and we can feel that. We don't necessarily have to share that with everybody and say, I'm scared. I don't know how to treat you guys, right? We don't have to go there because we want to feel safe and confident in us, right? So give yourself some grace because you're a human being, right? And it's tough to work with couples. The thing that I would say is if you're asking questions to be curious, and this pain cycle is a really good way to have some structure in what you want to be asking and the information you want to be gathering. Use the pain cycle, right? Use that to help you understand your patients and help them understand themselves, because then you have something to work with. You have some direction to go, right? You don't have to fix them right away. You don't have to save their marriage in the fit. Like this couple that we were talking about, it took the whole year of me being a student therapist, right? And I believe that they continued after I graduated. And then 3 years later, I saw them, right? So it takes some time. And so you don't have to fix them right away. And this is a great way to instill confidence in yourself because you've gathered a lot of really good information you can work with and say, okay, now I have a direction to go with these people. But it also, like I was saying before, it's like this magical experience for the client's patient. I'm working in medical settings, so I call them patients, but it's a magical experience for them, and they really gain a lot of confidence in the therapist when they step back and see that's exactly what's happening to us. How did you figure that out, right? It's really just them giving you information, but it really instills a lot of confidence on both sides, right? And so being curious, asking those questions, gathering more information, that's what I'd say.
So, Jake, where can listeners find out more about you and the resources that you offer?
Yeah, great question. So at this moment, I am not currently seeing patients or clients, right? I'm actually in a role of clinical manager, and so I'm managing other therapists at this point. I'm in the works of getting my private practice set up, which would be only a couple of hours a week because I want to maintain this other clinical manager role that I'm in. But once I have that all set up, then I can reach out to you guys and give you my information. You can send it out to anybody you need to.
Yeah, please do. Please keep us posted. Jake, hey, we like to ask our guests a couple of questions as we wrap up. The first one is this. What do you think is the key to a stronger marriage connection?
Oh, absolutely. Well, I said it a lot in this, but I think the key is understanding, right? It's truly understand. It's not just say, oh, I understand. It's, okay, I see where this is coming from, right? So it's understanding yourself. It's understanding where my emotions and my behaviors are coming from. And it's understanding your partner, where their emotions and their behaviors are coming from. If there's that mutual understanding there, you have so many opportunities to do anything you want in a marriage, right? You can go anywhere you want in a positive direction once you understand each other to that degree, right? So I think that's key. And a lot of people will say communication, right? Well, yeah, that's thrown in there, right? When you understand each other to this degree, you will communicate so much better, right? And so I think that's really key, at least in what I've experienced as a therapist and within my own marriage and things like that. So
Love the answer. Yeah, understanding creates compassion and so much more. Love it. Jake, what's a takeaway? We call it our takeaway of the day. Is there a take-home message you want our listeners to remember from our discussion today?
Yeah. I guess if you're a just a listener wanting to gain more insight in how to better your marriage, or if you're a therapist, I think the takeaway that I would have you take away from this is to recognize that we're all human beings. We're all human beings that are going to make mistakes, that we're not necessarily broken or wrong or anything like that because our love or trustworthiness was breached at some point in our life. We're just human beings, right? And when we understand that human element of ourselves, then we have so many opportunities to move in directions that are healthy and that we want to go, whether it's individually or within our relationship or within our family or at work or anything like that, right? So we're all human beings. We all experience these emotions together, and we can do something with them, right?
So good. Yeah, thanks, Jake. Liz, what about you? What's your takeaway?
Well, I think you're right. I think whether we're partners or just people, individuals, we're powerful. So as we look at the pain cycle or the peace cycle, I just think that there's probably a magic in the pause, just to think, now, wait a minute, where might that person be coming from? What's really going underneath their behaviors? So I love that. I love the reminder of that cycle. What about you, Jake? Dave, what stood out for you in our interview with Jake today?
Man, it's been really insightful not being a therapist and hearing different models, and it's been really helpful, Jake. I think what stood out is kind of what you talked about, the boxes and learning not to react to your partner's behavior, but really respond to what's underneath, and that's the emotions. And these needs are often deep and hidden, but if we can look past that and really see them and understand them, may not even agree with that, but still to understand with that understanding is powerful. And understanding this pain and these peace cycles that we're often blind to. We don't get it. We're so deep into it that we can't step outside and see that we're stuck, and often creating the very problems that we don't like in the own reactions in our partner, that we're almost helping to create those, which is this paradox, really. So it's been helpful, Jake. Thanks so much. We sure appreciate you taking time to join us today.
Yeah,
absolutely, my pleasure.
Good luck.
Okay, friends. No, go ahead. That does it for us for another episode of Stronger Marriage Connection. We'll see you next time.
And remember, it's the small things that create a stronger marriage connection. Take good care.
Thanks for joining us today. Hey, do us a favor and take a second to subscribe to our podcast and the Utah Marriage Commission YouTube channel at Utah Marriage Commission, where you can watch this and every episode of the show. Be sure to smash the like button, leave a comment, and share this episode with a friend. You can also follow and interact with us on Instagram at Stronger Marriage Life and Facebook at Stronger Marriage. So be sure to share with us which topics you loved or which guests we should have on the show next. If you want even more resources to improve your marriage or relationship connection, visit strongermarriage.org. where you'll find free workshops, e-courses, in-depth webinars, relationship surveys, and more. Each episode of Stronger Marriage Connection is hosted and sponsored by the Utah Marriage Commission at Utah State University. And finally, a big thanks to our producer, Rex Polanis, and the team at Utah State University, and you, our audience. You make this show possible. The opinions, findings, conclusions, and recommendations expressed in this podcast do not necessarily reflect the views of the Utah Marriage Commission.